Effleurage is one of the most versatile and frequently used of the classic massage techniques. Effleurage techniques slide and glide over the skin in a smooth and continuous motion. A therapist can use effleurage to help the client grow accustomed to touch and to warm an area, preparing it for deeper massage techniques. Effleurage is used throughout the massage when oil is applied to the client with long sliding strokes, and when it is used as a transition or a finishing technique. There are 3 guidelines for effleurage. Always begin with a light effleurage for the first few strokes, and then gradually increase your pressure for the desired effect. Use more oil or lotion if your client's skin is dry, or if the area you're massaging has a lot of hair. The extra oil or lotion will minimize pulling the hair. Limit the amount of oil you use. You do want some traction, and it's easier to add more oil if needed, rather than remove it once it's applied. Some examples of variations of effleurage are basic sliding, shingles effleurage, bilateral tree stroking, 3-count stroking of the trapezius, horizontal stroking, nerve strokes, and knuckling. When applying basic sliding effleurage, use your palms and fingers for full contact around the body. Use your thumbs and fingers for small spaces, such as between the small bones of the hands and feet. And around the shoulder blades. Stripping with the thumbs or fingers can be applied to individual muscles. Your fists and forearms are effective for applying effleurage on broad areas, like the back and the thigh. Shingles effleurage is performed by stroking alternately, left and then right, moving in a straight line. The technique mirrors the way shingles on a roof overlap one another. Strokes should overlap each other, leading with one hand and then the other in a continuous motion. Bilateral tree stroking traces a pattern similar to branches on a tree. Use it on the back, starting with hands on either side of the spine and moving laterally across the shoulders. Repeat down the entire back. Start either at the shoulders and progress down to the hips, or apply from hips to shoulders. 3-count stroking of the trapezius is done with 3 strokes, alternating hands with each movement. Timing is important so that the receiver feels continuous contact. Cover the broad area of the upper back and shoulder. Horizontal stroking is applied to broad, rounded areas like the thighs, abdomen, and lower back. The movement is across the width of the body part rather than the length. Horizontal stroking is sometimes considered a combination of effleurage and petrissage, since it has sliding, lifting, and pressing motions. Nerve strokes are a very light form of effleurage. They are applied by gently brushing the fingertips on the skin. Brief application of nerve strokes creates a relaxing effect. Knuckling is applied starting with the back of the fingers in a loose fist. Gradually turn the fist over as it slides and finish with the palm of the hand. Effleurage is useful to assess the condition of tissues. It also serves as a connecting or transitioning tool. Most importantly, the positive physiological effects of effleurage include increased circulation, the stretching of skin and muscle tissue, and general relaxation.